and this is Dr. Clare, your 2-kilometre gardener from, or herbalist from Dr. Clare's Apothecary in Galway. And today I've got a little update on the Coltsfoot. You may want to go back and access one of the first little videos I did, which was on the lovely dandelion-like yellow flower, which came out at the very beginning of to mid-March, and had no leaves. Very unusual. You can see it there. See where this flower stem has come out, and there's no leaves at the base. So there was just the yellow dandelion looking flower until you look closely. And again, you can see it's a puffball, but quite different from the dandelion puffball, if you look closely. And the coltsfoot also has a distinctive stem with these little notches on it, so quite distinct. And the flowers come up separate from the leaves. So the leaves come up alongside it, and they're called coltsfoot. I'm not a horsey person, so you can decide whether these are similar to a colt's foot. And the other thing that you'll notice underneath is that there's a furry back, quite furry, soft, downy. And the other thing that's quite familiar looking is this like a cobwebby appearance on the top of some of the leaves, not all of them. There's one without it, there's one with it. So it's quite a distinctive, I don't know of it occurring on any other plant. You'll often get a spread of them like this, especially if the earth has been disturbed. And coltsfoot is a long tonic herb, very good for anybody who has an exacerbation with chronic bronchitis or obstructive airways disease, and also for any acute chest condition. This is a herb that you wouldn't use on a continuous basis. It's strictly a medicinal herb. So if you have a tendency to recurring chest infections, or you want herbal assistance with a chronic condition like asthma or chronic obstructive airways disease, I would recommend seeing a medical herbalist. And I'll just remind you that we are doing full clinics, myself and my colleague Lara Jonasdottir, so feel free to make a distance appointment for the meantime. So take care of yourselves and be kind to yourself and others. All the best, Dr. Clare.